Hi everyone, my name is Emma DeVold. I'm going to tell you guys a little bit about my learning objectives that I have outlined based on my survey and analysis of the relationship between hospital-acquired pressure injuries, or HAPIs, and nurse staffing ratios in acute care settings, specifically during the COVID pandemic. I decided to do this project because a little over 3 months ago, my unit was presented with an award from our administration because we did not have a HAPI occurrence for a full year, and I didn't know a whole lot about HAPIs during that time, so I kind of wanted to research a little bit and see what the big deal was. So hospital-acquired pressure injury is a skin or tissue injury that can occur in a hospital stay for people who aren't able to get out of bed on their own or practice ADLs or activities of daily living on their own. So my learning objectives, number one is to investigate the potential relationship between nurse staffing ratios and occurrences of HAPIs in a hospital setting. I think that there's a significant relationship. I think it's going to be a negative relationship based on my hypothesis, seeing as when there was a significant decrease in available nurses during COVID, I think it possibly affected the occurrences of HAPIs to go up rather than go down because of the lack of availability of staff. And I'm mainly focusing on specific hospital units like med-surg, neuro-ICU, palliative hospice, mainly units where a lot of patients come from long-term care facilities, people who have higher Braden scale scores. My second one is to determine the significance of appropriate nurse staff to patient ratios. Typically on certain units, it's 1 to 4. So what that means is that one nurse should be assigned to 4 patients, and that is an appropriate amount of patients to take care of. That means that you're able to pass medication and provide, tailored patient care to your group that you're assigned to. I think that the underlying effect of having a limited amount of staff can pose a threat on the increase of HAPI occurrences for that, for those patients that you have. My third one is to explore challenges presented to underprepared healthcare facilities during this time. When I was working in Cincinnati, I started as a CNA in December of 2020, and I saw the decrease in staff, specifically nurses. A lot of nurses were leaving bedside or leaving the profession altogether. That was based on a lot of what I was seeing on my own floor and in the hospital during that time. And we also lacked a lot of resources as well during that time because it was a worldwide pandemic. The fourth one I have is to present new strategies for optimizing HAPI guidelines and prevention methods. Allowing for intervention, implementing new strategies for preventing HAPIs can further decrease HAPIs from occurring, obviously, for an entire hospital. It doesn't just go from unit to unit, it can be hospital-wide. Fifth one is to gain and provide insight when considering the contributing factors of HAPI occurrences. Things like not turning your patients every 2 hours, or not doing full skin assessments can be a contributing factor. And based on those contributing factors, you can implement strategies to decrease the regularity of these factors. And the last learning objective that I have is to understand the importance of individual care plans. All patients aren't going to be the same. A lot of patients are dependent on the help to get up out of bed and to be doing their activities of daily living. And having, an appropriate amount of patients, having too many patients can limit providing these individual care plans. So I believe that with skin assessments and those who have a higher Braden scale score need to have, a lot of HAPI prevention policies in their individual care plans. If you have any questions for me, I would like to see you reply to my discussion post. If not, that's totally okay. I hope everybody has a good week. Thank you.